we've learned with these meetings is that if you give people some breaks, appropriate breaks, and a little time to get a little bite to eat, I think we're all in a little better mood. I remember that first meeting was a little rough. So thank you. Okay, we will now move on to agenda item 14A, report on the results of the DCA's Office of Professional Examination Services review of the REB dental exam as required by Business and Professions Code Section 139. I will ask Ms. Tina Valerie, Chief of Administration and Licensing, to present this agenda item.
I apologize. This is Karen Fisher, Executive Officer. I'm going to jump in at this point to just introduce this agenda item. The cover memo is pretty self-explanatory, and as Dr. Stewart just mentioned, periodically we need to review our regional examinations to see if they're in compliance with Business and Professions Code 139. They review whether the exam is psychometrically sound and legally defensible. OPES has provided their recent review of the Western Regional Examining Board, and I'm going to hand it over at this point to Dr. Heidi Linzer to make any additional comments if necessary.
Good afternoon. This is Heidi. Can you hear me?
Yes.
Hi. You have the report in your packet of materials. So I just want to summarize that OPS performed a comprehensive review of the REB examination, and review found that it met professional guidelines and technical standards. So it meets the requirements of Business and Professions Code 139. And we also found that the use of the REB exam for licensure meets the requirements of the dental board under B&P Code Section 1630 and 1632. And we also, following the review of the REB psychometric procedures that they use, we conducted a linkage study looking to make sure that all of the areas of dental practice required for entry-level dentists were covered. And the linkage study determined that everything was covered with the exception of California law and ethics. And that led to a discussion with the subject matter experts who determined that dental candidates should be tested on a separate California law and ethics examination with which OPS provides to the board. We can answer any questions that anyone has.
Thank you, Ms. Linzer. It's always nice to have you with us.
Thank you.
Are there any board comments or questions? Ms. Linzer?
Dr. Stewart, Dr. Montel has her hand raised at this time.
Dr. Montel.
Hi, thank you. I just had a question. So, and it's just because I'm new to the board and I wasn't aware of any previous discussions on this, but are we just looking at this as an addendum, as another option for our dentists at this time, or are we looking at any phasing out the California test, or what was the impetus for this? Thank you.
You were kind of fading out there, Dr. Montel. I couldn't quite hear the question.
Can you hear me now?
That's better.
Okay. So yeah, I just wanted, as far as background on this, are we just looking at adding this as an additional option for licensure, or are we looking at this as replacing our existing California exam?
Dr. Montel, this is Karen Fisher. We have accepted the REB exam for many years now, and the board also recently moved forward and accepts the ADEX exam. So periodically, 5 to 7 years, the board has to conduct a review of those examinations. So this isn't anything new. This is just part of what is on our standard calendar, that we ensure that we keep the exams reviewed by the professionals. And so there's no action required on this item. It's just for the board's information. Does that answer your question?
Yeah, thank you for clarifying. I appreciate it.
You're welcome. Thank you.
Thank you. Any further board member comments? Dr. Montel, you can put your hand down, I think. Okay, thank you. And any public comments?
This is the moderator. We have opened the Q&A panel. If you'd like to make a public comment, please click on the Q&A icon on your screen, type "I would like to make a comment" into the Ask field, and submit that to all panelists. Dr. Stewart, while we await for any requests for public comment, I believe Dr. Lai has his hand raised.
Thank you. Dr. Lai.
I just had a question in regards to, I know we just did a review of the REB exam. I know we take 3 of the 5 disciplines, and then now with, I guess, the last decision was to take 5, as well as adding prosthetics and I guess the perio, because it wasn't required before. So I don't know. I think we're not doing any new changes, but I think because the perio now is under the written, we have a written perio, and we're not, I guess California doesn't require a prosthetics section. So I don't know if we want to keep in line with other states such as like New York, where we would have a test on all 5 disciplines. So I know we only take 3, but I don't know if we want to be in alignment with some of the other states. Because I was just on the DERB meeting, and there's some states that do require live patient. There's some states that require 3 sections, and some 5 sections, and then now there's this basically like the old denturist. There are dental technology degrees now. So I don't know if we, as a state board, want to kind of define what we want, or leave it alone. So that was my comment.
Karen, would you like to address that issue?
I'm not sure that there was a question in there, but I do want to clarify that the statute, our statute indicates that 5 competencies need to be tested. And from the RED report, it indicates that 5 competencies are tested. Statute is not prescriptive in how those competencies are tested. Statute just says that we offer a written and clinical exam. It does not say what portions of the exam need to be clinical. And I don't know if Dr. Lai, if that addressed your comment.
Yes, it does address my comment. I just want to put it out there that we have this, I know we take 5, but the exams are given in different capacities from what I understand nowadays. As far as live patients, as far as mannequin, so I want to make sure that we are still accepting the 5 in whatever capacity moving forward as a state board.
Thank you. Thank you, Karen, for that clarification. Further comments? Public comment?
At this time, we've received no requests for public comment. Would you like me to close the Q&A panel?
Yes, and thank you.
It is closed.
Thank you. We will now move on to agenda item 14B, Western Regional Examination Board Report. I will ask Dr. Bruce Horn, Director of Dental Examinations for the REB, to present this agenda item. Dr. Horn.
Dr. Stewart, I trust that you can hear me okay. Thank you.
Yes, thank you.
Okay, great. Good to be with you all. I'll make this brief. However, I'm willing to go deep into any section that needs additional clarification or description. We do, as you've alluded to, offer the 5 sections for licensure. Not all states require that, all 5 sections. The candidate certainly looks to see what state they intend to practice. They check the rules and statutes and sign up for those sections accordingly. Specifically, for 2021, there are a few changes, but those changes are only related to operative and perio. Let me go back and tell you that comprehensive treatment planning, our authentic simulated OSCE is still offered at Prometric, involves the review of 3 cases, diagnosis and treatment planning, and covers a wide range of test specifications, including prevention, restoration, endo, perio, pros, oral surgery, radiology, and so forth. As you remember, I'm sure or already know, this test is not a selected response, but a constructed response. It's an essay. They have a question with a blank screen for which they are to keyboard their answer. So there isn't a choice of answer to select from as in a multiple choice. It certainly involves their ability to give us an answer, develop a treatment plan for these 3 cases, one of which is always a pediatric case. Our endodontic simulation remains the same. Candidates must perform 2 endodontic procedures on simulated teeth mounted in a segmented arch. The mannequin is positioned to simulate working on a patient. Rubber dams required. The specific teeth we use are copyrighted. They're scanned from human teeth and they're produced by way of 3D printing. They replicate internal and external anatomy and include polymer hardness for enamel, dentin, and pulp tissue. The anterior tooth requires the candidate to access, instrument, and obturate. The posterior tooth requires the candidate to access, extirpate the pulp, and identify the canals that are present. Currently, the posterior tooth is a lower molar. Prosthodontic section remains the same. The melamine teeth are provided to the candidate in an arch. The candidate will tell us what the intended restoration is for the preparation they desire to do. That'll either be a full coverage crown, all ceramic crown, or a PFM crown. The single anterior tooth will be an all ceramic crown. It's usually number 9. And then there is a requirement to create 2 abutments on a posterior bicuspid and also a molar. They need to have line of draw or you're not able to be successful during the examination. And they have sufficient time to complete that in the sim lab. That's also done under universal precautions and also in a simulated format. What's different this year for REB is that our operative simulation is available as an alternative to the patient form of their operative section. So right now we have a patient-based examination for operative, just like we always have had. Same criteria, same procedure, same administration. Candidates must have their patient qualified by demonstrating radiographically that there is a lesion that is at or beyond the DEJ, and so forth. So should they submit a patient that does not qualify radiographically or can be accepted, there's a penalty for poor diagnosis and so forth. The alternative to that under COVID-19 concerns that started last year and continue this year is that we use now simulated teeth. The simulated teeth we're using this year for 2021 are new for the Class 2 and the Class 3 preparation. They're new to respect that the enamel and dent layers are present. There's an identifiable dental enamel junction. The caries is present. It's impregnated into the tooth. The color and tactile sensation are improved. the caries vary somewhat and tends to spread along the DEJ. So our desire in our prescription to the manufacturer is to place the caries in a way where there is some variability. Not every student will have the same tooth and in terms of the depth of caries. However, all candidates will be required to initiate modification requests to demonstrate to us their skill set. That incurs their having to prepare the tooth to the criteria of a 5 according to RIB scoring data. They're to stop and advance their preparation due to disease, whether it be caries or affected dentin, in a modification request format until the disease is removed. We also provide to the candidates radiographic reference and interpretation with these simulated teeth. So issued to the candidate is not only the arch for them to prepare the distal lingual of number 9 and the mesial-occlusal of number 14, but there are radiographs included that allow the candidate to look and see the extent of the decay and also specifically on the posterior tooth on number 14. The radiograph indicates that there is decay in the distal pit. Should the candidate think they're just doing a class 2 box preparation and forget or fail to recognize radiographic decay on the pre-op films, they certainly would incur a critical error and would fail the examination. And again, both preparation and restoration are accomplished in full simulation with rubber dam isolation. The operative section, again, includes both the patient-based care and the simulation. There are some states that are looking at reinstituting, as according to statute and by rule, patient-based treatment. Candidates are somewhat confused as they matriculate in a certain state and decide to take an examination as to what they actually will be required to bring with them for a successful application in any given state. So right now, REB is prepared to offer patient-based operative or simulated operative. In fact, at some sites, we may be offering both depending on the desires for section completion by the candidates. I think this simulation is here to stay. I think that the vendor that we're using to produce these teeth are now up and running past their COVID hiatus like the rest of us. There is one vendor that is supplying most of the examining agencies with teeth, so we're somewhat challenged to be certain that any changes we want to incorporate it in teeth for the next year or two be designed and set in stone early enough so that they can certainly make that production available to us and those changes can come forward. That's really it. I would be willing to answer any in-depth questions with any other section, but I want to finish with mentioning to you as far as your collective board peace of mind. The comparative analysis of pass or fail outcomes on the dental examination between last year, 2019, and 2020 indicates that there's no statistically significant difference in proportion passing between those 2 years. In fact, there was only a 0.5% difference between the patient-based examination that we gave in 19 and the simulated activity that we gave in 2020. So we're, and in addition, the comparability in candidate performance, the non-patient-based dental examination is also showing comparability in examiner quality, exam site comparability, and technical indicators. So if you require additional details, or if OPS requires additional details on examination contents, the results, or our technical quality, which results in our technical report, we'd be glad to provide that to you again. One thing I do need to mention is that last year, I believe California accepted our comprehensive treatment plan OSCE examination for the periodontal requirement in lieu of patient treatment. That is still available to the state of California and any other state in lieu of patient treatment. However, we have also added the mannequin component to the periodontal section this year. So for perio, we have a patient-based form that remains the same. The mannequin section of the perio discipline does not require the candidate to qualify a patient. They're provided an arch, and one of those quadrants will be laden with calculus, and their job then is to identify and gently remove calculus in a simulated universal precautions condition where the patient is placed in a physiological reclined place, including the opening of the jaw and so forth, so that there isn't any advantage. And the tissue that accompanies this arch is of a texture that is something that allows us to evaluate the candidate's handling of simulated gingival tissue. Should they cause a tear or laceration, they would certainly fail the exam for critical error. So available to you from REB for the periodontal section, if in fact you require that, and I can't remember if that's one of your 3 requirements or not. I think it probably is not, but we have available either the patient-based treatment, CTP, as a computer-based alternative for periodontal, the periodontal section, or the simulated periodontal section. I would be happy to answer any questions or go deeper into any other section if you require.
Thank you, Dr. Horn. Let's open it up to the board member for board member comments. I see Dr. Lai's hand up.
Hi, Dr. Lai.
Hi, Dr. Horn. How are you? I'm
fine.
going to defer to Dr. Morrow first, because you probably, I did listening on the meeting, so I just wanted to add some background information. So maybe go to Dr. Morrow first, please.
Okay.
Dr. Morrow, go ahead.
Welcome, Dr. Horn. This is Steve Morrow.
Hi, Dr. Morrow.
We appreciate you meeting with us. It is my understanding that historically the endodontic section on the REB examination is has one of the highest failure rates of any of the other sections on the exam. Is that correct?
Yes, but only by a percentage point or two. You know, operative is somewhere around 96. And when we say passing point, there are three different ways to describe that. There's overall, there's by first-time takers, and then by section. So I may have Sharon send you information about those three derivatives. But however, the endo examination has been found to be more challenging than the others. Yes.
Okay. Is it possible for us to be made aware of what areas of the endodontic examination are presenting challenges?
Absolutely. And I'm making a note here to have Sharon, our psychometrician, send to you or to Karen that information that will give a breakdown on both the accumulated scores, critical errors, and overall failure and passing rate for endo. Yes, sir.
I appreciate that. Thank you very much.
Thank you, Dr. Horn. If you could have Sharon send it both to Dr. Morrow and to myself, that'd be great. Thank you.
I will do.
Further board comments?
So this is Dr. Lai. I want to make my comments. Dr. Stewart?
Yes, please.
Hello, Dr. Horn again. Ross Lai. There are three things that I just kind of want to put out there, so the new members and members that have been following this transition have some background information that I kind of researched on my own. So I have three questions. One is that new practice tooth available to graduates or students prior to the examination, and if there is a specific type of dot they have to buy too, and are they familiar with it before they go into the test? That's my first question. Second question would be, what's the overall cost to the student now or the graduate now, being that there isn't live patient exam in some areas? Number three, how is our site availability as far as examinations for the new grads? Those are my two questions.
Oh, okay. So the first question, yes, the tooth, finger quotes here, that that Reb will use is available to the candidate, but it's not the exact tooth. The part of the tooth that's the same are the materials, the dentin, the enamel, the DEJ, the anatomy is the same tooth that's available to them to practice. What is proprietary, if you will, is the location of the caries within the tooth. So we have we work with the engineers to design how we want to laden the caries along the DEJ or more towards the proximal wall, so forth. And then we task the engineers at Accidental to give us caries randomly in these three areas. So that would be the testing tooth. And that's not unlike our endo tooth. You know, our endo tooth is copyrighted, and the candidates can certainly practice on the endo tooth in terms of its access with burrs, diamonds, or carbides, and so forth, but they won't get the exact same tooth. We copyright that and keep that as a testing tooth. So the same will be true with operative, but quite honestly, they should be able to get comfortable with the handpiece they want to use, the burr they want to use, and also their access through the polymer materials that make up these teeth that we're using. So it's sort of a yes and a no.
Okay, and with that, go ahead.
Yes.
And with that, are the examiners calibrated on what they, as far as extension? Is there a criteria that all the examiners are kind of calibrated on to make sure that's fair?
Yes, and to that extent, I will tell you that we made an effort intentionally not to change criteria between the patient-based exam or the simulated operative exam. The criteria is the same. The administration is almost identical. The modification request behavior is about the same. Now, obviously, when we were doing patient-based treatment, candidates could decide to treat a patient that had a tooth that had such a minimally qualifying lesion that they could have prepared their tooth to the criteria of a 5, axial wall depth 1 to 1.5 millimeters measured mesial distally, and pulpal floor depth not to exceed 2 millimeters, and never need a modification request because they were able to get a tooth approved that was so minimally qualifying. Well, that really was not as standardized as that we can do that now with teeth where we design the decay, the placement and depth of the decay. So the criteria is the same. The grading examiners will be calibrated to score these teeth just the way they were with the simulated teeth they used last year, and very similar to the way they scored the teeth that belong to patients when we were treating patients. So that answer would be yes. As far as costs to the student, it's interesting that there's a couple costs that they don't incur anymore, and some of them I think the schools will be happy about. One is that there aren't patients that are expecting gifts from the candidates anymore. That seemed to be something that was kind of an ethereal growing area that we were aware of, but something we're happy that candidates aren't having to deal with our sim operative. the overall cost to the candidate for the exam has decreased a little bit because the school access fees aren't as high. So our standard REB fee remains about the same. Our cost to administrate and implement the exam really hasn't changed much. What's changed, though, is that we don't require, REB doesn't need to occupy a clinic from the school and hold up patient production if they're back to seeing patients again on a large scale like we were before. So if the schools do not if the schools recognize that and do not charge that school use fee, which at some schools is as high as $900 per candidate, let me take that back. I think it was $850 last year was our highest one. Then the cost should go down to the students that become our candidates for a few days.
Thank you. Thank you, Dr. Horn. That's great. And hopefully everybody appreciates that comment. Thank you very much.
Further board member comments? Dr. Morrow, your hand's up.
Yes, thank you. Dr. Horn, I have a question on the last comment that you made regarding the need to utilize the school's patient care clinic in order to administer the examination.
Yes.
Are you indicating to me that if the school has a simulation laboratory, that this facility could be utilized for the clinical examination instead of the clinic?
My answer to your question is yes, but I want to clarify a few terms. So the simulated clinical examination that will not require patients is usually accomplished. All of our field testing and everything that we did last year with Sim Operative was in the preclinic where the candidates were socially distanced and we had sufficient sections to where we could separate people to safely finish what we needed to. We weren't able to send examiners last year because of COVID concerns. So these this operative activity by the candidates was scored off site. We had calibrated grading examiners gather and score those all at one time in a socially distanced environment. So what's different with the simulated sections is that we don't need to be in the patient clinics necessarily. If there's a simulation lab at the school that's large enough, and most of them are now, we're able to accommodate all the examination sections with the candidates in the sim lab. And certainly not take up the resources or the extra PPE and the rest of that in the clinics, nor do the schools need to close those down to have us have exclusive access for the 2 or 3 days that it used to be.
Yeah, I appreciate that because I'm sure you understand that part of the cost for the REB examination as far as the school is concerned is the fact that we lose our clinic revenue for the period of time that the examination is being conducted.
Absolutely.
If we could conduct that in our sim lab, we could still continue then to provide patient care, and it would reduce the cost to the candidate for the examination.
Yes. Right. Now, let me say this. There was a few schools where the school had decided to close a couple clinics like on a floor, but this is more COVID related than it was towards having this exam completed all in one area. And having said that, what I'm getting at is that a few deans had mannequin setups that were attached to the back of dental chairs in the clinics. And some of the examination was spread out for social distancing that went through the clinic, and it was very nice. It was simple. It didn't require any special needs because there was no patients there, of course. So, but that was their choice to close the clinics and have that available for extra space for the exam if we needed it. But to your point, the cost of the exam should go down. And we would anticipate that it will. We'll see this year.
Okay, thank you very much.
Any further questions from the board for Dr. Horn? Seeing none, let's open it up to public comments.
This is the moderator. We have opened the Q&A panel. If you'd like to make a public comment, please click on the Q&A icon on your screen. Type, I would like to make a comment into the Ask field and submit that to all panelists. Seeing no requests for comment, would you like me to close the Q&A panel?
Yes, please.
It is closed.
Thank you. We will now move on to agenda item 14C, American Board of Dental Examiners report. And I will ask Dr. William Pappas, President of the ADEX, and Dr. Guy Champagne, Vice President of the ADEX, to present this agenda item. Dr. Pappas.
Dr. Pappas, this is the moderator. If you could please unmute your microphone so we can do a microphone check.
How's that?
We can hear you. Thank you.
Thank you. Thank you, President Stewart, board members, and staff. I'm afraid Dr. Champagne was unable to attend today. He is stuck in an examination, so you're stuck with me. ADEX completed its 16th annual meeting on November 7th via web conference, which, like many groups, was a new experience for us. Since the examination continues to perform well psychometrically, only very minor housekeeping changes were made. In 2020, we examined at 57 dental schools in the U.S., and it looks like in 2021, the ADEX examination will be offered at 62 dental schools. As of January 1st, 2021, the examination will be accepted in every U.S. jurisdiction except for New York, which only licenses by postgraduate residency, and Delaware, which gives their own exam. The Confidant continued to perform well since we last met, and we were making advancements, including multiple lesions and caries extending variably on the occlusal surface of the molar. Practice teeth for candidates should be available in 2021. Our OSCE, which examines all areas identified in occupational analysis not directly examined in the clinical examination, will be enhanced for 2021. First computerized in 2001, new item types will be included. Multiple choice, both single and multiple response, extended match, drop down, fill in the blank, hotspot, and drag and drop will be added. This is the most advanced dental OSCE in the world. Our periodontal exam is included in the OSCE as the last 3 occupational analyses, which span the life of the ADEX exam, identify periodontal diagnosis and treatment planning, not scaling, as the important skill set. ADEX has over 1,000 examiners through our administering agency partners, so we're able to send local teams to examine, thus minimizing travel. We continue to work with local, state, and school authorities to provide exams in responsible and acceptable ways. Our examination runs a 12-month cycle. We're examining throughout the year. We at ADEX hope that our 2021 annual meeting, which is scheduled for August 6th and 7th, we may welcome the Dental Board of California as a member board. We would like very much to have your input in exam development. Thank you, and this concludes my report.
Thank you, Dr. Pappas. Board member comments? Dr. Morrow.
Thank you, President. Welcome, Dr. Pappas, and appreciate you spending a few minutes with us today. Could you inform us as to, now that we have 6, almost 7, soon to be 7 dental schools in California, how many dental schools in the state of California are you are now currently conducting the ADEX exam?
Currently, we offer the exam at both the University of Pacific and the University of Southern California.
Have you made any attempts to encourage other schools in the state to also offer the exam?
Yes, our administering agencies have reached out to all the dental schools in California that have graduating classes.
Okay, thank you very much.
You're welcome.
Thank you, Dr. Morrow. Further board member comments? Let's move on to public comments.
This is the moderator. We have opened the Q&A panel. If you'd like to make a public comment, please click on the Q&A icon on your screen. Type "I would like to make a comment" into the Ask field and submit that to all panelists. Our first request for public comment comes from Dr. Bruce Witcher. Dr. Witcher, your microphone is unmuted and you will have 2 minutes.
Thank you, Dr. Bruce Witcher, former board member again. Just a question for our Dr. Pappas. Which examining agencies are giving exams in California, understanding that California has approved the REB exam, however, that is only an exam, and the exam is actually administered by several different agencies, I believe.
Our examination is currently offered by the CDCA, the Commission on Dental Competency Assessments in California.
So NERB and none of the other agencies are doing the exam, just CDCA, if I understand correctly.
Yeah, CDCA is the agency that used to be referred to as NERB. They changed their name a few years back, and the other agency that offers is CII, the Coalition of Independent Testing Agencies.
But they're not doing an exam in California.
Not at the time that I'm aware of. I know they've done some outreach to some of the schools, but currently the only one that is offering in California is CDCA.
Thank you.
You're welcome.
Further public comment?
Seeing no, actually we do have one additional comment from Bruce Horn.
Hi. As a matter of clarification, the Western Regional Examining Board administers and provides its own examination. There aren't other entities that provide the REB exam. With the ADEX examination content, Dr. Pappas may want to comment on this, there are a few different entities that provide that examination, but right now REB is the only entity that provides its own exam. Thank you.
Thank you.
Yeah, if I may, this is Dr. Pappas again.
You bet.
That's the construct of the ADEX exam. It's the ADEX examination is a product of our member states, which is part of the reason why I would encourage California to become a member. The ADEX examination is offered by our administering partners. In this case, the two that are administering partners in the U.S. are CDCA and CII. But the ADEX examination is a product of the member boards.
Thank you for that.
Seeing no additional requests for comment, would you like me to close the Q&A panel?
Yes, and Dr. Pappas, again, thank you for being with us this afternoon.
You're welcome. Thank you, Dr. Stewart.
Bet.
Dr.
All right,
Stewart, Dr. Morrow still has his hand up.
Okay,
Well,
Tomorrow?
I was unable to lower it. The icon to lower the hand was not active, so now it became active again. Thank you.
Okay, thank you. Okay, we will now move on to agenda item 15A, review of dental licensure and permit statistics. I'm going to ask Ms. Jessica Olney, Manager of the Anesthesia Unit, to please report on this agenda item.
Hi, good afternoon. Thank you, Dr. Stewart. Jessica Olney, Anesthesia Unit Manager. What I'm presenting this afternoon is agenda item number 15, a review of the dental licensure and permit statistics. If you look at agenda item 15A, page 156 of your meeting material, section A is a breakdown of the dental license status. We have currently almost 35,000 active dentists in California, 1,800 inactive dentists, 1,300 retired or reduced fee dentists, 108 disabled, 354 dentists who have a renewal in progress, and this could be due to a deficiency, and 5,700 delinquent status licenses. We have a total of 18,000 licenses that have been canceled since licensing was required. If you continue to page 157, the next table lists the licenses issued by pathway. California currently offers 5 pathways to licensure. Licensure by REB, licensure by ADEX, licensure by portfolio, licensure by residency, and licensure by credential. And licensure by credential is the only pathway that does not require an examination. The next table is a breakdown of the licenses and permits that the board issues, with a breakdown of current permits and delinquent. And the third column is the total number of permits that have canceled. Scrolling down, the next page is a breakdown of the active licensees by county as of June of 2020. And that would be counties in California. And also the last line of that table is a breakdown of out-of-state licensees. If we move to page 159 in the agenda item, I'll ask you to please look at the screen as we have made some corrections to some of those numbers. Bear with me for just one moment. These next tables in section B will break down the number of applications received by month. And if you look at the attachment on the screen, we've adjusted some of those numbers. The total number of applications for dental licenses received to date is 1,298. Board staff have approved 1,024 applications and have issued 1,037 licenses to date this year. The last few pages are tables, charts, which show the trends of when applications were received. You can see that the summer months are usually our busiest, and that's due to graduation season. And if anyone has any questions, I'd be happy to answer those.
Thank you, Ms. Olney. Any board member comments, questions? Dr. Morrow?
Thank you, Dr. Stewart. Ms. Olney, I have a question regarding the retired status for licensure. I understand that your brief description here is that they need to have been in practice for 20 years, eligible for Social Security, and practice with restrictions. Could you give me a brief description as to what the restrictions are that they can practice under?
Yes, actually, the restriction is that a dentist who has a reduced fee cannot earn more money in a calendar year than which would make them ineligible for full Social Security benefits. And that is how it is written in section 1716.1B of the Business and Professions Code.
So it's a matter of the amount, the dollar income from their practice that limits, not the type of practice that they conduct. Is that correct?
Correct. a dentist can still qualify for a reduced license fee and have an active license, which allows them to do volunteer work, work part-time in clinics. It's still possible to have an active license.
Okay, an example would be this. A retired dentist that meets all of those requirements, in order to have a faculty appointment at a dental school in the state, they have to have an active license. Would that retired license meet the requirement as an active license for purposes of a faculty appointment for a retired dentist?
Yes. So I know that this is listed as a retired status. What this is a reduced renewal fee. And the reduced renewal fee is offered to dentists who have met those requirements. You can still have an active dental license or an inactive dental license. And the practice is not restricted.
Right, but my understanding is that for a faculty appointment at a dental school, it needs to be an active license.
Right.
But a retired license is still considered an active license, is that correct?
Yes, it is.
Thank you very much.
Thank you, Dr. Morrow. I see Ms. Burton's hand up.
Would you adjust your chart back up to the top again where you made the changes in numbers? I'm not sure I picked all of those up.
Board members, we will send you copies of this chart so that you don't have to make those changes yourself.
Okay,
so,
thank you.
Yes, you're welcome.
Further comments from the board? Seeing none, let's move to public comments, please.
This is the moderator. We have opened the Q&A panel. If you'd like to make a public comment, please click on the Q&A icon on your screen. Type, "I would like to make a comment" into the Ask field and submit that to all panelists. Seeing no requests for comment, would you like me to close the Q&A panel?
Yes, and thank you.
It is closed.
Thank you. We will now move on to agenda item 15B, general anesthesia and conscious sedation permit evaluation statistics. Ms. Jessica Olney to please report on this agenda item.
Before we continue, Ms. Burton, did you have an additional question or did you just forget to push your hand down?
All right. It's down.
Thank you very much. Go ahead, Jessica.
Thank you, Karen. For agenda item 15B, this is the statistics for the general anesthesia conscious sedation permit program. I wanted to just let you know that we have new staff who are filling the anesthesia unit who have been working very hard to reschedule and schedule new on-site inspections and evaluations for many permit holders who were canceled earlier this year due to COVID. They have done a great job at scheduling evaluations and continue to do so. And I just want to thank them and also present to you the agenda items. You can see that in March, April, May, and June, we almost came to a complete stop. In fact, in April we did. So we are now getting back on track and starting to schedule those evaluations again. And if anybody has any questions, I'd be happy to answer those for you.
Board member comments? Seeing none, can we move to public comments?
This is the moderator. We have opened the Q&A panel. If you'd like to make a public comment, please click on the Q&A icon on your screen. Type "I would like to make a comment" into the Ask field and submit that to all panelists. We have a request for comment from Dr. Bruce Witcher. Dr. Witcher, your microphone is unmuted. You will have 2 minutes.
Thanks. I think we all anticipated there would be a reduced number of evaluations due to COVID-19, and we can see that here. In order to keep the general anesthesia evaluations current, we need to do about 160, 170 a year. So we're slightly off, but it looks like we're picking up here toward the end of the year, so that's reassuring. As far as conscious sedation evaluations go, those are somewhat diminished around the same time of year, but we did 70, which is really not bad. You might recall we actually applied to DCA for a waiver for this evaluation. However, that was not granted. And again, the area that we've always had the hardest time staying current in are the medical general anesthesia evaluations. And, we only did 2 all year, which is, certainly not a big number. And I think it's just because those are extremely hard to schedule. The providers move around a lot, and to get them to commit to a time and place and then get the double degree oral surgeon lined up to do the evaluation along with another qualified person is quite difficult. So that's just an area that we need to keep an eye on. Thank you.
Thank you, Bruce.
Seeing no additional requests for public comment, would you like me to close the Q&A panel?
Yes, and thank you.
It is closed.
We will now move on to agenda item 16A, 2021 tentative legislative calendar, and I will ask board member Ms. Fran Burton to facilitate this agenda item. Ms. Burton. Fran, are you muted?
Sorry, I was having a very long conversation. And I guess I was just entertaining myself. Apologize for that. So this is what you see is the tentative legislative calendar for 2021. This is projected in a downloadable file, and the moderator will provide instructions on how to view it, and I suppose how to download it.
This is the moderator. If you would like to pull down a copy of this calendar, you can click on File at the top menu of your screen, select the transfer option, and it will give you the option to download the file.
Okay, say that again. I'm using myself as a guinea pig and it's not happening.
Okay, so across the top of your screen on your menu bar, you should see File as an option. It should be the very first option. If you click on that, then you should see an option for transfer.
Yes.
You click on that. At the top of your screen should be a download button. If you click on the attachment, which should pop up in the list of files, then you can click the download button and it should download it to your computer or whatever device you are using.
Okay, so it downloads it and it saves it?
Correct.
Okay. Okay. So everybody has that. I guess the most significant thing there is, the legislature reconvenes on January 4th. And we will go from there, and who knows what kind of year it will be. I will say this to you, for those of you who are not in Sacramento, my understanding is that because of COVID and because of the size of the assembly will actually hold hearings at the downtown arena. And so if you had that, then let's move to the next item, which is 16B, which is the end of the year legislative summary report. I'm going to ask Gabriel Nevin to provide a summary of this.
Thank you, Fran. This is Gabriel Nevin, Legislative and Regulatory Analyst. So staff have tracked and presented numerous bills this two-year legislative session, as are detailed in the attached memo. The enacted bills are detailed in the summary report, which is attached to the memo, and staff are available to answer any questions that the board has. Staff are asking that the board consider and possibly adopt the attached legislative summary and direct staff to post the report to the board's website.
Are there any questions?
Not seeing any hands up.
Okay. So then I would like to ask for a motion on this, on the end of the year legislative report. And I'm going to move it. So is there a second?
Stewart will second it.
Okay. Any public comment?
This is the moderator. We have opened the Q&A panel. If you'd like to make a public comment, please click on the Q&A icon on your screen. Type, "I would like to make a comment" into the Ask field and submit that to all panelists. Seeing no request for comment, would you like me to close the panel?
Yes, thank you.
It is
There's
closed.
been a motion and a second, Madam Secretary, and the motion is to adopt the legislative summary for the end of the two-year legislative session and direct staff to post it on the board's website. So if you would please call the roll.
This is Pacheco, Secretary. I will now call the roll. Burton?
Burton, aye.
Burton, aye. Felsenfeld?
Felsenfeld, aye.
Felsenfeld, aye. Lai?
Lai, yes.
Lai, aye. Laren?
Laren, yes.
Laren, aye. McKenzie?
McKenzie, yes.
McKenzie, aye. Medina?
Medina, aye.
Medina, aye. Mendoza? Mendoza, aye. Molina?
Molina, aye.
Molina, aye. Montel?
Montel, aye.
Montel, aye. Morrow?
Morrow, aye.
Morrow, aye. Olagi?
Olagi,
Olagi, aye. Pacheco, aye. Stewart?
Stewart, aye.
Stewart, aye. You?
You, aye.
You, aye. Motion passes. Thank you.
Thank you. And Gabriel, thank you for your great work on this. It looks good.
Thank you, Fran. Appreciate
So
it.
we're going to move to item 16C, discussion and possible action regarding legislative proposals for 2021. And this is the Healing Arts Omnibus Bill. And if you would please, Gabriel, give us a summary.
Yeah, thank you. This is Gabriel Nevin, Legislative and Regulatory Analyst. So legislative committees solicit omnibus bill proposals in January at the beginning of the legislative session. Omnibus bill proposals should be non-controversial and are intended to be used for technical cleanup. Board staff have identified a gap in the statutory structure for the anesthesia licenses, which were last modified by Senate Bill SB 501 in 2018. Beginning in January 1, 2022, there will be a new class of pediatric minimal sedation permit, which will replace the current oral conscious sedation permit for minors. In addition to creating this permit, SB 501 established at BPC 1647.33 that the application and renewal fee for the newly created pediatric minimal sedation permit shall not exceed the amount prescribed in another Business and Professions Code section 1724. Now, despite this clear reference to section 1724 contained in the changes in SB 501, it appears that section 1724 was not updated to include the maximum fees for the new pediatric minimal sedation permit. Therefore, staff recommend adding a provision to the BPC section 1724, which covers the pediatric minimal sedation permit application and renewal maximum fees to close this gap. Staff are suggesting mirroring the language from the other sedation permits and inserting this language, rather than inserting it at the end, inserting it on section S so that it maintains the structure of the rest of the section. This changed language is attached in the memo and is highlighted in yellow for the board to review. Now, staff believe that this is a technical cleanup which will not be controversial and is therefore a good candidate for inclusion in an omnibus bill. However, if the committee or stakeholders find this proposal too controversial for inclusion in an omnibus bill, staff will seek out an appropriate legislative vehicle for this proposal. The action requested here is, after consideration of the staff recommendation, staff requests that the board accept, reject, or modify the recommendations and direct staff to prepare the proposal for submission to the committee for inclusion in the 2021 Healing Arts Omnibus Bill. Staff also requests that if the committee will not include this proposal in the omnibus, the board directs staff to find an appropriate legislative vehicle or author to carry this proposal. Thank you.
Thank you. So, board members, are there any questions? Okay, seeing none, is there a motion and a second to accept the Healing Arts Omnibus Bill, item 16C? And if you would please do it by a show of hand. Dr. Stewart?
We've got James Yu, Joanne Pacheco.
Yes.
Let's start with James Yu.
James Yu motion.
Okay.
Thank you,
Motion
Dr. Yu. Ms. Pacheco?
Second.
Joanne?
I seconded the motion.
bill has been moved and seconded. Are there any public comments?
This is the moderator. We have opened the Q&A panel. If you'd like to make a public comment, please click on the Q&A icon on your screen. Type "I would like to make a comment" into the Ask field and submit that to all panelists. We have a request for comment from Dr. Bruce Witcher. Dr. Witcher, your line is unmuted and you will have 2 minutes.
Okay, thank you. This should be a pretty straightforward piece of cleanup to this bill. All it does is add in a fee which is consistent with the current fee for the pediatric oral conscious sedation permit. So it isn't really a fee increase or anything. It was just an oversight in construction of the language. And so this is a good candidate to put it into a omnibus bill because it should be non-controversial. And it's going to be complicated without having a fee. It probably won't be possible to issue the pediatric minimal sedation permit. That's why they'll need to go find an author and still get it through. So this is probably the easiest way to manage this little technical fix here. So I would urge your support for this. Thank you.
Seeing no additional requests for public comment, would you like me to close the Q&A panel?
Yes, please.
It is closed.
And thank you for your comment, Dr. Witcher. Board Secretary, this bill has been moved and seconded. I would ask you to call the roll, please.
This is Board Secretary. I will now call the roll. Burton?
Burton, aye.
Burton, aye. Felsenfeld?
Felsenfeld, aye.
Felsenfeld, aye. Lai?
Lai, yes.
Lai, aye. Laren?
Maren, yes.
Laren, aye. Mackenzie?
Mackenzie, yes.
Mackenzie, aye. Medina?
Medina, aye.
Medina, aye. Mendoza?
Mendoza, aye.
Mendoza, aye. Molina?
Molina, aye.
Molina, aye. Montel?
Montel, aye.
Montel, aye. Morrow?
Morrow, aye.
Morrow, aye. Olagi?
Olagi, aye.
Olagi, aye. Pacheco, aye. Stewart?
Stewart, aye.
Stewart, aye. You?
You, yes.
You, aye. Motion passes.
Thank you. The next item is item 16C II, discussion and possible action regarding legislative proposal to eliminate the RDA-EF practical and clinical exam. So I'm going to ask first the moderator to please project this on the screen, and then ask Gabriel Nevin, the board's legislative and regulatory analyst, to provide a summary of the legislative proposal to repeal the RDA-EF practical and clinical exam.
Thank you, Board Member Burton. As the board is aware, their board and staff have been working to find a solution to the cancellation of the RDA-EF clinical and practical examinations since the beginning of the COVID-19 pandemic. And at the August 2020 meeting, the board acknowledged the challenges with the administration of the RDA-EF clinical and practical examinations, the fact that the RDA-EFs are a supervised profession requiring supervising dentists to determine when a RDA-EF is ready to practice and perform the duties of their licensure, the fact that the board has not received consumer complaints relating to RDA-EFs performing these tested procedures, and the fact that the board has already suspended and then eliminated the registered dental assistant practical examination for similar issues. As a result, the board directed staff to seek an author to carry legislation to repeal the requirements of the RDA-EF clinical and practical examinations permanently. Staff have not yet identified an author to carry this legislation. However, with the assistance of counsel, staff have developed the proposed statutory changes which are attached to this memo. With the approval of the board, staff will use this legislative language to solicit an author to carry this proposed language as new legislation in 2021. The action requested here is that the board approve or modify the attached proposed statutory changes, eliminating the statutory authority for the Rdaef practical and clinical examinations, and direct staff to find an author to carry legislation to repeal the requirements of the Rdaef clinical and practical examinations permanently. And I just want to call attention to the fact that the written action requested has a typo referencing the clinical and written examinations. That is incorrect. And the motion is to ask to repeal the Rdaef clinical and practical examinations. Thank you.
Thank you, Gabriel. Is there a motion and a second? And if you would please use the raise hand function. I see Member Ology.
Thank you, Mrs. Burton. Yes, I would like to motion to have the staff move forward with seeking to remove the practical or the clinical examination from the Rdaef requirement.
Thank you. And Member Molina.
I actually have a question.
Can I ask you to
Dr.
hold
Molina,
it?
if you could hold your comment. Dr. Felsenfeld was first. Let's see if we can get a second to the motion before you can ask your question.
I will second the motion. Felsenfeld.
Thank you.
Thank you, Dr. Felsenfeld. Now, pardon the interruption, Dr. Molina, but now go ahead and ask your question.
Yes, thank you. So why can the exam be given with a typodon instead of removing it altogether?
Ms. Fisher?
Is Tina Valerie available? A portion of the examination requires a patient and a dentist to attend the examination. So there's difficulty in using the patient. And if we've got Tina Valerie on the phone, let's wait one moment to see if she's available to expand on this. Hold on, please. While we're waiting for Tina to get to be able to respond, I see that DCA Legal Counsel Tara Welch has her hand raised. Go ahead, Tara.
This is Tara Welch, Attorney 3 of DCA Legal Affairs. I just wanted to point out that the memorandum indicates that part of the problem with administering the practical exams is space at the UCLA School of Dentistry and San Francisco School of Dentistry. So I think even though perhaps you could utilize a typodont mannequin, the issue is that it's difficult to administer that type of practical exam because of the competition at the universities in administering the practical exams. There's just not enough room to do so. I just wanted to point that out in addition to whatever Ms. Valerie might have to add. Thank you.
This is the moderator. Tina Valerie is connected, but she's having some audio issues. She's unmuted, but we're unable to hear her, and we're checking that with her now.
This is Sarah Wallace, Assistant Executive Officer. I think I can help here. The registered dental assistant and extended function exam is unique in that the procedures are specified in statute. We are required to administer a clinical exam that has to be administered on a patient and graded by an examiner appointed by the board. And then we also have to administer a practical exam that has specific procedures listed in statute. Because it's listed in statute, we don't have the flexibility of being able to offer the examination solely via typodont or change the procedures that are being tested or change the format of the testing. We have consulted with the Office of Professional Examination Services over the last, since March, regarding the administration of the exam. And similar to the issues that we were having with the registered dental assistant examination, it was determined that because the RDAEFs are a supervised profession and they go through the additional educational requirements to be able to perform these functions, a practical and clinical examination doesn't add to the determination of minimal competence, and a written examination is sufficient. But predominantly because the procedures are outlined in statute, we do not have the flexibility of modifying the exam short of seeking statutory change via a legislative proposal. And I'd be happy to answer any other questions.
This is Dr. Lai, Sarah. Ms. Wallace, this is Dr. Lai. I have a question.
Hi, Dr. Lai.
Hold on
How are you?
If you would, Ross, hold on
Sure.
just a second.
Sure.
Member Melina still has her hand up. Did that answer your question?
Yes, it did. Thank you.
Okay. Okay. And so if you would take your hand down, please. Okay, now, sorry.
No, I'm sorry. I didn't mean to interrupt. The question is, would it even be possible to outsource the exam either to ADEX or REB to administer for us?
So, Dr. Lai, in answer to that question, the board has researched that previously. We worked with OPES, and I believe that recommendation was brought to the board at the August meeting, that there were no other regional examinations available that would have an equivalent exam to be able to outsource to. We're still in discussions with Office of Professional Examination Services, but at the same time, we're cognizant of not putting together barriers to licensure because it's questionable as to whether or not the clinical and practical examination really are necessary to determine minimal competence. Exams are getting away from the practical and clinical formats, and it has been OPES's recommendation that it would not be necessary, predominantly because this is not a supervised profession. We have not had a consumer protection issue as a result of these professionals administering these procedures out in public. And therefore, they've made the recommendation that we can capture those procedures as part of the written examination. Does that answer the question, Dr. Lai?
Well, my intent was saying that if we stop certain exams, we're going to get into a situation where my concern is the question of RDAEFs wanting to do injections, if there's going to be courses in anesthesia for the EFs. So I kind of want to make sure we're doing the right thing in regards to how much the board can control certain areas of the EF, their duties and their abilities to administer care.
Mm-hmm.
So I'm just being very cautious in saying if we're going to, slow this process down now, or we're just going to move forward. I'm just concerned that in the future, we're getting ourselves into a situation where we're going to lose control of examining this group of dental professionals.
Mm-hmm.
Just my comment.
Just to address the board's role, the duties and settings for the registered dental assistants and the registered dental assistants and extended functions are all outlined in statute. So that would, for those to change, it would take a legislative proposal to add additional duties, which would be brought forth to the board for discussion and consideration for us to be able to put together a position letter. The other option for expanding functions is through regulations that the board would have oversight through that process. And to clarify, I believe there was a proposal at one time for the RDAEF to be able to administer local anesthesia. That was a proposal made by a stakeholder. That was not accepted by the board. So at this point, it's not on the table until the board further discusses that issue.
Yeah, I understand that, and that's why I'm trying to move cautiously in making sure that we're doing the right thing moving forward. And I don't have an issue either way, but I just want to make sure we have a little bit of control over that. That's all. Thank you.
This is Karen Fisher, Executive Officer. Thank you, Dr. Lai, for your comments. I just want to bring this agenda item sort of back on track. The board discussed this issue at the August meeting, and this particular agenda item at this meeting is in response to the board's direction, which was to bring this language back to remove the practical and clinical from the exam. So thank you for your comments, Dr. Lai. If any additional board members need additional information for this, you can go back and look at the minutes and or call Sarah or I. We'd be happy to walk through that. But at this point, this agenda item is essentially responding to the board's direction to bring back statutory language to be able to move forward with removing the clinical and practical examination for the RDAEF. Are there any additional questions? And Dr. Lai, if you'd like to put your hand down, please. Ms. Burton, I think we're handing this back over to you.
Okay. We're going to move to public comments, and I will ask the moderator to facilitate the lines for public comment, please.
This is the moderator. We have opened the Q&A panel. If you'd like to make a public comment, please click on the Q&A icon on your screen. Type "I would like to make a comment" into the Ask field and submit that to all panelists. Our first request for comment comes from Claudia Pohl. Claudia, your mic has been unmuted and you will have 2 minutes.
Thank you so much. Yes, Claudia Pohl with CDAA. As I stated at the August meeting, I speak against this. I certainly understand the limitations, particularly with COVID, about the practical and clinical exam, but strongly feel that there needs to be some kind of a test, bench mount or otherwise. Thank you.
Our next request for comment comes from Dr. Bruce Witcher. Dr. Witcher, your microphone is unmuted. You will have 2 minutes.
Hi, I was hoping we'd hear from some of the EFs on the Dental Assisting Council, of which I was formerly the liaison. A couple of things to consider here in response to Dr. Lai's comments. First of all, these are supervised duties, and if a dentist doesn't feel comfortable delegating them, he has the option not to delegate them. The other thing is, if we do an examination, it'll have to go through a development process, and OPES will probably have to be involved, and it has to be psychometrically sound and statistically valid. So much like we did with the RDA exam, going to a written, if you do it the right way, I think provides sufficient public protection. obviously the first step is just to repeal the existing requirements because we can't really do anything until we do that. So, I would hope that everybody would support this because it is the path forward out of a difficult situation because we have a lot of EF graduates who are unable to get licensed and take the exam. So they're stuck just functioning basically as RDAs. They can't make use of the advanced training a lot of them paid a lot of money to get. So I hope we can see our way forward to move this. Thank you.
Our next request for comment comes from Joan Greenfield. Joan, your microphone is unmuted and you will have 2 minutes.
Hi. Everyone hear me?
Yes, we can.
Okay, thank you. Good afternoon. As you can see, there was a letter from the EF Association up on the screen, and I just want to kind of summarize that real quickly. We are in support of removing a patient-based assessment and have felt for some time that that should be something that would be removed. We are concerned, however, that without the information from a hopefully redesigned bench restorative exam or other definitive process, that the board doesn't have accurate information on the performance of individual schools and programs. And it's something that we have been aware of for some time. When the I think, Karen, you may recall a number of years ago, and some of the staff may recall a number of years ago, that there was an extremely high fail rate from one particular school that had been consistently having poor pass rates on their examination. And it wasn't until the board looked at those statistics that they became aware that the program should probably require some additional motivation to do a better job. So our biggest concern is that if you remove the examination process in a redesigned restorative examination, that you won't have statistical ways to do that. There may be other ways to follow through. I know, of course, you always have your approval process and reapproval process, but those don't really meet what we're talking about. It's very difficult for someone to not do a good job with the program and you not realize what's going on. So that's our major concern.
This is the moderator. Seeing no additional requests for public comment, would you like me to close the Q&A panel?
Yes, please.
It is closed.
Okay, thank you everyone for your comments. We have a motion and we have a second. And I'm going to ask the board secretary to please call the roll.
This is Joanne Pacheco, board secretary.
Excuse me, this is the moderator for one moment. I apologize. We did have one commenter that was missed. Would you mind if I go back and allow her to comment?
Please.
Okay, that is from Jerry Fowler. Jerry, your line is unmuted. You will have 2 minutes.
Hi, thank you. This is Jerry Fowler. I just wanted to comment that I do agree with Dr. Lai. I am concerned, and also with Joan Greenfield, I'm concerned about removing both the clinical and the practical.
I'm sorry to interrupt. Ms. Fowler, I'm sorry to interrupt. As a newly appointing dental assisting council member, there's some question about whether you can make this comment at the meeting at this time. So I would ask that you stop making this comment and we can have this comment offline. Dental assisting council members are new and we went through an orientation yesterday. Because you're a dental assisting council member, it's probably not appropriate for you to be commenting outside of the council in a full board meeting without having discussed it at the full council meeting. So we can discuss this further offline.
Okay, thank you. My apologies.
No problem.
This is the moderator. That concludes public comment on this item.
This is Pacheco, board secretary. I will now call the roll. Burton?
Burton, aye.
Burton, aye. Felsenfeld?
Felsenfeld, aye.
Felsenfeld, aye. Lai?
No. Lai, no.
Lai, nay. Laren?
Laren, yes.
Laren, aye. Mackenzie?
Mackenzie, yes.
Mackenzie, aye. Medina?
Medina, aye.
Medina, I. Mendoza.
Mendoza, I.
Mendoza, I. Molina.
Molina, I.
Molina, I. Montel.
Montel, I.
Montel, I. Morrow.
Morrow, I.
Morrow, I. Olagi.
Olagi, I.
Olagi, I. Pacheco, I. Stewart.
Stewart, aye.
Stewart, I. You.
UI.
You, I. 13 I, 1 nay. Motion passes.
Thank you. Our next item is item 16C III. Discussion and possible action regarding California Dental Association's legislative proposals for 2021. And I will ask Gabriel Nevin to present this item, please.
Thank you, Board Member Burton. This is Gabriel Nevin, Legislative and Regulatory Analyst. The California Dental Association has provided the attached letter regarding a legislative proposal for informational purposes. CDA representative will be available at the meeting to speak to this item. Staff are not requesting any action at this time. Thank you.
Are there any board questions? Board member questions? You would raise your hands, please. I see member Montel.
Hi, sorry, just to clarify, this is talking about the letter for lab testing licensure legislation. Is that correct?
Talking about what? I'm sorry.
Is he referring to the letter about the lab testing licensure legislative?
Yes,
Okay. Yeah, so I had a couple of questions about this. One, just to clarify, so is the letter basically saying that a dentist can't not perform a test because they would have to be considered a lab director and their office, because they have a dental office, they cannot be a lab director for labs exclusively performing a wave test. Is that correct? I was kind of confused about that. Can you clarify?
Now, do we have Mary McCune on?
Moderator, is Mary McCune? Would you elevate Mary McCune?
Yes, I just promoted her.
Thank you.
Hi,
Okay,
can you guys hear me?
Go ahead.
Great, thanks. So to answer your question, Dr. Montel, the issue here is that dentists, so in order to perform a waived test, you have to be on an enumerated list in statute that's really overseen and regulated by the Department of Public Health. That enumerated list does not specifically include dentists, but when you look at the federal counterpart to lab licensure, because in order to perform tests, you need both federal and state lab licensure. Dentists are able to receive that federal CLIA lab licensure. When you're looking at a lab testing laboratory for these purposes, it's really going to be considered the dental office. And what we're seeking is just to be able to list lab director or list dentists to be lab directors so they can perform COVID rapid tests.
Okay, so just to clarify, so what about dentists who are working in federally qualified health centers, or as I have dentists, or dentists who are Department of Public Health dentists who work with labs that perform normal medical testing and other tests besides these CLIA ones?
Yeah, so typically in those settings, it's probably not an issue because there's going to probably be somebody on staff that can be listed as a lab director. Oftentimes in those settings, the medical director can be listed as the lab director and the dentist can administer the test because it is within scope. This isn't a scope issue at all. They'll just perform the test under the medical director's lab license. But when you're looking at a dental office, there's nobody that is currently eligible to serve as a lab director according to the Department of Public Health.
Okay, great. So we're looking just really, this is just about private dentists in general. Okay, that helps a lot. Thanks.
Okay, I see James Yu.
I have a question. For the CLIA certificate, I've been trying to apply for this certificate. I even have problem to get one.
Right, and that's because the legislation that we're going to be proposing will help alleviate that. We're in this catch-22 right now where technically you are eligible for the CLIA certificate, but because the federal CLIA certificates are issued by the laboratory field services within the California Department of Public Health, they're going to kick it back because under state law, you are not eligible. So they're not going to give you just the federal license right now, despite you already being qualified.
I
So we're
see.
just trying to realign federal and state law. Yeah.
Okay, thank you.
Member Yu, okay, thank you. Any other board member questions? Are there any other public comments?
This is the moderator. We have opened the Q&A panel. If you'd like to make a public comment, please click on the Q&A icon on your screen. Type, I would like to make a comment into the ask field and submit that to all panelists.
Can I interrupt real quick? Because I'm not able to actually submit it because I'm a panelist right now.
Absolutely.
Go ahead, Mary.
Great, thank you. Mary McCune, California Dental Association. Just wanted to be able to put this in front of the dental board at this point right now, despite not having a bill introduced, simply because once there is a bill introduced, we wanted to have board members familiarized with the issue in case there would be an opportunity for the board to formally support. Thank you.
Seeing no requests for public comment, would you like me to close the Q&A panel?
Yes, please.
It is closed.
Okay, Mr. President, we're moving on to item 17A.
Thank you, Ms. Burton. Appreciate that. Thank you. We'll now move on to agenda item 17A, discussion and possible action to initiate the dental assisting comprehensive rulemaking. I will ask Gabriel Nevin, the board's legislative and regulatory analyst, and Danny Rogers, board regulatory legal counsel, to present this agenda item.
Thank you, President Stewart. This is Gabriel Nevin, legislative and regulatory analyst. So the dental assisting comprehensive rulemaking has been in development since workshops began in 2015. The proposed language was reviewed and approved by the council during the joint November 2019 meeting with the board. And subsequent to that approval, staff received substantial feedback from stakeholders, which necessitated further revisions. The council reviewed and approved those revisions at the joint February 2020 meeting and directed staff to present the language and the accompanying forms to the board. Now, the forms took longer than anticipated, but are now completed and are attached for the board's consideration and approval. The staff recommendation is to initiate the rulemaking with the understanding that stakeholders will have further opportunity to comment during the 45-day public comment period. In addition, staff made a few technical and non-substantive changes to clean up the language and make it more internally consistent, and I'll go over those real quick. The text now added back in the repeal of 1014 and 16 CCR 1014 and 1014.1. These sections were implicitly repealed and were included in other drafts of this and had just failed to be included in the most recent draft, so they've been added back in. We've also cleaned up references to basic life support, education, and certification to make them more consistent and to also remove any possibility that we are referring to a particular provider's class and rather reference the curriculum that is required to be taught. We've also made conforming cleanups in 16 CCR 1070L, conforming that course directors are not required to maintain advisory board meeting minutes, as courses are not required to have advisory boards. That is a requirement that applies to RDA programs only. We've also corrected citations at 1070.2 G2, which applies a limit of 40 hours of didactic and laboratory instruction as part of an RDA devoted to clerical and dental practice management curriculum. The previous citation referenced curriculum requirements writ large, not these specific requirements. We've also corrected a citation at 1070.2 H5A, which previously referenced the old radiation safety course requirements that are being repealed and are in 1014 and 1014.1. We've also moved the language from former 16 CCR 1070.4 H6A to 16 CCR 1070.4H. This was just a sort of orphaned clause that didn't make sense where it was. It was a one-item list, which is disfavored by OAL, and the terms of the language didn't apply to the one section. They applied to all didactic instruction. We've also made conforming equipment requirement changes in 1070.5 by adding a list of orthodontically banded typodont as required equipment in the equipment list. It is mentioned later on in the section, and so it made sense to put it back up in the equipment list area so that everyone wouldn't be confused. There are numerous references to programs contained, there were numerous references to programs contained in the courses, and also references to courses contained in program areas. There were a number of them at 1070.5I, but they were sprinkled throughout the rest of the document, and we've attempted to clean those up. We've also cleaned up a reference to fees at 1071A3. Previous section referenced a fee for the processing of an application for a registered dental assistant and extended functions program approval, and it left a blank space. Rather than fill that in and have to change it in another place, we've just referenced 16 CCR 1022, which is where the rest of the fees for these programs and courses lives. We've also made conforming changes to the required hours of educational methodology instruction for RDAEF course program providers. There were several references to the old standard of 30 hours, which had slipped through when this had been changed, I believe in November of 2019, or possibly July of 2019. There was a repetitive subsection at 1071H3. It just duplicated, including calling it subsection 3 again, and so that's been deleted. There are also conforming changes made to the names and the dates of the forms, which are now incorporated to the rulemaking so that they would be consistent. So staff are requesting that the board consider and possibly approve the proposed regulatory language and all forms therein incorporated by reference relative to the dental assisting comprehensive rulemaking, and direct staff to take all steps necessary to initiate the formal rulemaking process, including noticing the proposed language and forms for 45-day public comment, setting the proposed language and forms for a public hearing, and delegating authority to the executive officer to make any technical or non-substantive changes to the rulemaking package. If, after the close of the 45-day public comment period and public regulatory hearing, no adverse comments are received, delegate authority to the executive officer to make any technical or non-substantive changes to the proposed regulations before completing the rulemaking process, and adopt the proposed language to amend California Code of Regulations, Title 16, Sections 1067, 1068, 1070, 1070.1, 1070.2, 1070.3, 1070.4, 1070.5, 1070.6, sections 1070.6, 1070.7, 1070.8, 1071, 1076, 1077, 1077.1, 1080, 1080.2, 1080.3, 1081, 1081.2, 1083, 1085, 1087. will also include repealing sections 16 CCR 1014, 1014.1, 1069, 1071.1, 1072, 1072.1, 1080.1, 1081.1, 1086, and add sections 1070.9, 1077.2, 1077.3, 1081.3, and all forms therein incorporated by reference relating to the dental assisting comprehensive rulemaking as noticed in the proposed text. Thank you.
Now, board members, this is Karen Fisher. And if you refer to page 204 of your board meeting materials, the action requested, which Gabe just wonderfully read, does not need to be repeated. Just refer to the action requested on page 204, and we'd like a motion and a second so that we can open up discussion.
Thank you.
Dr. Stewart,
Go ahead, Ms. Ology.
Yes, I would like to motion to approve the proposed language and initiate the formal rulemaking process. And my motion comes with, for the last 5 years we've been working on this, but really thanking staff, stakeholders, the DAC, and the board working together in 2019 and 2020, adding additional hours to the calendar to really get this moving and move forward. And thank you for everyone's time with this, but thank you, Karen.
Dr. Stewart?
I'd like to second that motion.
Thank you, Dr. Stewart. Ms. Burton? Actually, who's taking over at this time, Dr. Stewart or Ms. Burton?
Member Stewart is doing this.
I think I am.
All right.
All right, so got our hands off, Ms. Ology?
Down right now, Dr. Stewart, my apologies.
So fortunately, we don't have to reread that. Now let's get to board member comments. Seeing none, are there any public comments?
This is the moderator. We have opened the Q&A panel. If you'd like to make a comment, please click on the Q&A icon on your screen. Type "I would like to make a comment" into the Ask field and submit that to all panelists. Our first request for comment comes from Dr. Bruce Witcher.
Thank you. Witcher. Thank you. Me again, this time wearing my dental assisting council liaison hat. What I think you can appreciate looking at this document just by its length is the amount of work that went into this. I'll spare you all the gory details of the history, but this has been the subject of countless hours, countless workshops, just an immense amount of work, a lot of input from stakeholders. I remember Sarah, who is one of the primary movers behind this, saying that this document will never be perfect, but it's certainly at a point where it needs to go forward into rulemaking. And this, of course, doesn't preclude other comments and changes being made, because that's what that process is for. But I would really like to thank Sarah for taking such leadership on this, and all of her staff over in the dental assisting unit, including Tina, who helped draft a lot of the language, and especially Gabe Nevin, who really whipped this thing into shape and got it looking like a good document. We've had so many ledge analysts have gone over this, and they've just sort of burned out on this project. So I really strongly support moving this forward into the regulatory process, and it'll be really good to get this done. Thank you.
Our next request for comment comes from Melody Randolph. Melody, your line is unmuted and you will have 2 minutes.
Thank you. Melody Randolph, representing CADAT, California Association of Dental Assisting Teachers, Daggers Dental Assisting Educators Group, and CDAA, California Dental Assistants Association. We also would like to thank everybody for their hard work on this. We have been working on this long and hard for a long time, and it's getting very, very close. We did send to Sarah yesterday an email with numerous clerical things that may have been fixed with Mr. Gavin's comments here that they were fixed, but there were a number of things, again, referencing a program director versus a course and so forth. But we still do have 6 remaining critical issues that we would like to discuss further. So when it goes to the 45-day, I understand that now is not the time to say that, but or to discuss them. But when it goes to the 45-day public comment, we will be bringing 6 critical issues up for revision. Thank you.
Thank you for that comment. Any further public comment?
No further requests. Would you like me to close the panel?
Yes, please.
It is closed.
And thank you. And Board Secretary, will you please call the roll and record the votes for this agenda item?
Yes, this is Pacheco, Board Secretary. I will now call the roll. Burton?
Burton, aye.
Burton, aye. Felsenfeld?
Felsenfeld, aye.
Felsenfeld, aye. Lai?
Lai, yes.
Lai, aye. Laren?
Laren, yes.
Laren, aye. McKenzie?
McKenzie, yes.
McKenzie, aye. Medina?
Medina, aye.
Medina, aye. Mendoza?
Mendoza, aye.
Mendoza, aye. Molina?
Molina abstain.
Molina, abstain. Montel?
Montel, aye.
Montel, aye. Morrow?
Morrow, aye.
Morrow, aye. Olagi?
Olagi, aye.
Olagi, aye. Pacheco, aye. Stewart?
Stewart, aye.
Stewart, aye. You?
You, yes.
You, aye. Motion passes.
Thank you. Well, we will now move on to agenda item 17B, discussion and possible action to initiate the notice to patients of licensure by the Dental Board rulemaking. I will ask Gabriel Nevin, Board Legislative and Regulatory Analyst, and Danny Rogers, Board Regulatory Legal Counsel, to present this agenda item.
Thank you. This is Gabe Nevin, Legislative and Regulatory Analyst. Last year's AB 1519 updated the requirements of Business and Professions Code 1611.3. This is a statute that requires that the dental practitioners post a physical notice inside their facilities informing consumers that dentistry practitioners are licensed and regulated by the California Dental Board. AB 1519 added a requirement that this notice include the fact that dentists and dental assistants are regulated by the board, and it added a requirement that patients who receive services through telehealth receive an electronic version of the notice, which would be physically posted in a physical location. Now, staff have developed the attached proposed regulatory language for Section 1065. 16 CCR Section 1065, which will add the requirement that patients who receive services through telehealth receive an electronic notification, and will update the language of the physical notice as required by the statute. The action that's being requested today is to consider and possibly approve the proposed regulatory language related to notice to patients of licensure by the Dental Board, and direct staff to take all steps necessary to initiate the formal rulemaking process, including noticing the proposed language for 45-day public comment, setting the proposed language for a public hearing, and delegating authority to the executive officer to make any technical or non-substantive changes to the rulemaking package. If after the close of the 45-day public comment period and public regulatory hearing, no adverse comments are received, delegate authority to the executive officer to make any technical or non-substantive changes to the proposed regulations before completing the rulemaking process, and adopt the proposed amendments to California Code of Regulations, Title 16, Section 1065, as noticed in the proposed text. Thank you.
Thank you, Gabe. At this time, I think I'm looking for a motion and a second. Please use the hand. Raise your hand. Dr. Felsenfeld and Ms. Burton.
I will move all that Mr. Nevin just said.
Want to second the motion, please? Burton.
Burton, second. Thank you. Please turn off the hand feature. Are there any board member comments?
I'm going to use this opportunity, since I haven't put my hand down yet, to say that this is something else that has been a long time in coming, and I'm glad to see it finally start to move.
Thank you, Ms. Burton, for that comment. Further board member comments? Are there any public comments?
This is the moderator. We have opened the Q&A panel. If you'd like to make a comment, please click on the Q&A icon on your screen, type "I would like to make a comment" into the Ask field, and submit that to all panelists. Seeing no requests for comment, would you like me to close the panel?
Yes, please.
It is closed.
Board Secretary, will you please call the roll and record votes for this agenda item?
This is Pacheco, Board Secretary. I will now call for the vote. Burton?
Aye.
Burton? Is that aye?
Burton, aye.
Thank you. Felsenfeld?
Felsenfeld, aye.
Felsenfeld, aye. Lai?
Lie, yes.
Lai, aye. Laren?
Laren, yes.
Laren, aye. McKenzie?
McKenzie, yes.
McKenzie, aye. Medina?
Medina, aye.
Medina, aye. Mendoza?
Mendoza, aye.
Mendoza, aye. Molina?
Molina, aye.
Molina, aye. Montel?
Montel, aye.
Montel, aye. Morrow?
Morrow, aye.
Morrow, aye. Olage?
Olagi, aye.
Olage, aye. Pacheco, aye. Stewart?
Stewart, aye.
Stewart, aye. You?
You, aye.
You, aye. Motion passes. Thank you.
Thank you.
Dr. Stewart, I'm hoping we're on the same page and that maybe we could take our 15-minute break now and then come back and finish up with the update on the pending regulatory packages and elections and whatever. Is that possible?
Yes, that's very possible. 15 minutes, if you can put that up on the screen, we'll take a break for 15 minutes. We'll return at what time?
I think the math is at 2:50.
Let's try it again. Yes, 2:50.
2:50.
Thank you. Ready to go?
Yep, staff and the moderator are ready to go.
Thank you, Karen. We will now move on to agenda item 17C, pending regulatory packages. I will ask Gabriel Nevin, the board's legislative and regulatory analyst, to present this agenda item. Thanks, Gabe.
Thank you, President Stewart. This is Gabe Nevin, legislative and regulatory analyst. So I'm going to start with our continuing education basic life support equivalency standards. Now, staff have drafted the initial rulemaking documents, and councils reviewed those documents and approved them. The updated fiscal materials were sent to budgets on June 17, and these documents were approved on August 25. But at that time, Regulatory Council recommended combining this rulemaking with the related rulemaking regarding continuing education and opioids. Because these two proposed rulemakings affect the same regulatory code section. So staff are now working with council to combine the initial rulemaking documents before submittal to DCA for review as required before submitting the documents to OAL for noticing. Our citation and fine rulemaking was approved by agency on August 25, 2020. And following that approval, staff filed the final phase rulemaking documents with OAL on September 4, 2020. And staff are working with OAL now to move this package through the OAL review process. The continuing education requirements for opioids. Again, this is the same as the basic life support equivalency continuing education rulemaking. At the recommendation of council, we've combined these two, and we're in the process of developing the formal rulemaking documents to initiate the rulemaking in 2021. The comprehensive rulemaking was just presented, and staff will be drafting the initial rulemaking documents for approval and initiation. The determination of radiographs and placement of interim therapeutic restorations rulemaking. Board staff have drafted the initial rulemaking documents and are working with board legal counsel to review. Once council approves, staff will submit the initial rulemaking documents to DCA for review as required before submitting the documents to OAL for noticing. The Diversion Evaluation Committee membership rulemaking was approved. The initial rulemaking documents were approved by DCA and agency on October 30, 2020, and staff filed the approved documents with OAL for publication in the California Regulatory Notice Register on November 20, 2020. The public notice and comment period is running now and will run through January, I need to update that, it should say January 5, 2021. If no comments are received, staff will begin the final rulemaking process. The elective facial cosmetic surgery permit application requirements and renewal requirements rulemaking. Staff are working with regulatory counsel to finalize the initial rulemaking documents before submitting them to DCA for review as required prior to submitting the documents to OAL for public notice. The dentistry law and ethics exam scoring rulemaking. Board members will remember that the language was modified and the rulemaking was reinitiated at the August meeting. So staff are working with regulatory counsel to finish the supporting rulemaking documents and initiate this rulemaking for the formal process. The mobile dental clinic and portable dental unit registration requirements rulemaking. Board staff have drafted the initial rulemaking documents and are working with regulatory counsel to review these documents. Once counsel approves, staff will submit the initial rulemaking documents to DCA for review as required before submitting the documents to OAL for noticing. Minimum standards for infection control rulemaking. Again, staff have drafted the initial rulemaking documents and are working with legal counsel to review the documents. Once they've been approved, staff will submit the initial rulemaking documents to DCA for review as is required before submitting the documents to OAL to start the notice period. The substantial relationship criteria rulemaking was filed with OAL on August 10, 2020, and staff have been working with OAL representatives to address questions that have been raised by OAL attorneys. And this rulemaking is also undergoing concurrent review by the Department of Finance. When Finance signs off on this, we're expecting OAL to finish their review relatively quickly. Board members will remember that this is part of a larger set of rulemakings that the department has been helping all the boards and bureaus with. And that concludes this report, and no action is requested at this time. Thank you.
Thank you, Gabe. Board member comments? Ms. Burton, I see your hand up.
I just, again, wanted to say thank you. This rulemaking process, and the regs is always the most arduous thing. And so to get to this point is really complimentary of all the staff who worked on this. So this is just a big thank you.
I'll second that. Further member comments? Seeing none. Public comment?
This is the moderator. We have opened the Q&A panel. If you'd like to make a comment, please click on the Q&A icon at the bottom of the screen. Type "I would like to make a comment" into the Ask field and submit that to all panelists. Seeing no request for comment, would you like me to close the panel?
Yes, thank you.
It is closed.
All right, we will now move on to agenda item 18, election of 2021 Dental Board of California officers. I will ask our EO, Karen Fisher, to present this agenda item. Ms. Fisher.
Thank you, Dr. Stewart. What we'll do is we'll begin the nomination process with the nomination of the secretary, then followed by the vice president, then followed by the president. We only need one person to nominate. That does not require a second, but we will vote on the nomination once it's closed. So I'm opening up the nominations at this time for the position of secretary. If you are willing to nominate a person for secretary, please use the raise hand feature. Dr. Morrow? I'm sorry, Dr. Morrow, you're muted.
I'm unmuted. I had
There you
my
go.
honor and it is my honor and privilege to nominate Dr. Alan Felsenfeld for the office of Secretary for the Dental Board of California.
Thank you. Dr. Felsenfeld, do you accept the nomination?
I do. Thank you, Felsen.
Thank you. Thank you. Are there any additional nominations from the floor? I'm closing the nominations. There is the nomination of Alan Felsenfeld for the office of secretary. Madam Secretary, will you please call the roll?
I would happily call the roll here. Burton?
Abstain.
Felsenfeld?
Aye, Felsenfeld.
Felsenfeld, aye. Lai?
Lai, aye.
Lai, aye. Laren?
Laren, aye.
Laren, aye. Mackenzie?
Mackenzie, yes.
Mackenzie, aye. Medina?
Medina, yes.
Medina, aye. Mendoza?
Mendoza, aye.
Mendoza, aye. Molina? Yes, Molina?
Molina, aye.
Molina, aye. Montel?
Montel, yes.
Montel, aye. Morrow?
Morrow, aye.
Morrow, aye. Ology?
Ology, yes.
Ology, aye. Pacheco, aye. Stewart?
Stewart, aye.
Stewart, aye. You?
UI.
Motion passes.
Congratulations, Dr. Felsenfeld. You are now the board secretary effective January 1st of 2021. And I'm sure that Ms. Pacheco will be happy to mentor you in that position.
I look forward to it. Thank you all.
We're now moving into the position of vice president. The nominations are now open. I see Dr. Morrow. Did you need to put your hand down? I saw Dr. Stewart's hand pop up.
Yes, it's my pleasure and privilege to nominate Dr. James Yu as Vice President of the Dental Board of California.
Thank you, Dr. Stewart. Dr. Yu, do you accept the nomination?
Be my honor. Thank you.
Dr. Lai, do you have your hand up?
Yes, I do.
Are there additional nominations from the floor?
I want to make a nomination, please.
Go ahead.
I would like to nominate my friend and coworker on the licensing committee, Rosalinda Ology, for vice president.
Ms. Ology, do you accept the nomination?
Yes, I accept. Thank you, Dr. Lai and team.
Okay, are there any additional nominations from the floor? Okay, what we're going to do first is Secretary, I think, will vote on James Yu, the nomination of James Yu for Vice President. Please call the roll.
Yes. Burton, for you. Burton?
Burton, aye.
Burton, aye. Felsenfeld?
Felsenfeld, no.
Felsenfeld, nay. Lai?
I know.
Lai, nay. Laren?
Laren, this is a tough decision, but no, thank.
Nay. Mackenzie?
Mackenzie, abstain.
Mackenzie, abstain. Medina?
They're both candidates, but I'm going to say no on this one.
Nay. Mendoza?
Mendoza, abstain.
Mendoza, abstain. Molina?
Molina, abstain.
Molina, abstain. Montel?
Montel, abstain.
Montel, abstain. Morrow?
Morrow, aye.
Morrow, aye. Ology?
Ology, no.
Ology, nay. Pacheco? Aye. Stewart?
Stewart, aye.
Stewart, aye. You?
UI.
You, aye. We have 5 aye, 5 nay, 4 abstain.
I'm going to ask board counsel, what do we do? The vote was 5 aye, 5 nay, 4 abstain. Is it appropriate to move on to the next candidate?
Correct. The motion did not pass if it was not a majority. A tie is a fail.
Okay. We will move on to the nomination of Rose Ology for the position of Vice President. Secretary, would you take the vote?
Burton?
Burton, aye.
Burton, aye. Felsenfeld?
Felsenfeld, aye.
Felsenfeld, aye. Lai?
Lai, yes.
Lai, aye. Laren? Laren?
Oh, sorry, I was muted. Yes, Larry, yes.
Aye. Laren? Aye. Mackenzie?
Yes, Mackenzie, yes.
Mackenzie, aye. Medina?
Medina, aye.
Medina, aye. Mendoza?
Mendoza, aye.
Mendoza, aye. Molina?
Molina, abstain.
Molina, abstain. Montel?
Montel, abstain.
Morrow?
Morrow, aye.
Morrow, aye. Ology?
Ology, aye.
Ology, aye. Pacheco, aye. Stewart?
Stewart, aye.
Stewart, aye. You?
Abstain.
You abstain. 11 aye, 2 abstain. Motion passes.
Congratulations, Ms. Ology. You are the Vice President of the Board, effective date January 1st of 2021.
Thank you.
Now accepting nominations for the position of President. Ms. Burton, you have your hand raised.
I would like to nominate Joanne Pacheco.
Ms. Pacheco, do you accept the nomination?
I accept.
Are there any additional nominations from the floor? I see Ross Lai's hand up. Dr. Lai? Okay.
I'm sorry,
Dr.
that was
Lai.
a mistake. I'm sorry. I didn't. Sorry.
All right. I see no other nominations from the floor. We'll close the nominations. Madam Secretary, will you take the vote?
Burton.
Burton, aye.
Burton, aye. Felsenfeld.
Felsenfeld, aye.
Felsenfeld, aye. Lai.
Lai, yes.
Lai, aye. Laren.
Laren, aye.
Laren, aye. McKenzie.
Mackenzie, yes.
McKenzie, aye. Medina.
Medina, aye.
Medina, aye. Mendoza.
Mendoza, aye.
Mendoza, aye. Molina.
Molina abstain.
Molina, abstain. Montel.
Montel, aye.
Montel, aye. Morrow.
Morrow, aye.
Morrow, aye. Olage.
Aye.
Olage, aye. Pacheco, aye. Stewart.
Stewart, aye.
Stewart, aye. And you.
You, I.
You, aye. 13 aye, 1 abstain. Motion passes.
Thank you. Congratulations, Ms. Pacheco. And I'd like to take this opportunity to say that you've done an excellent job as secretary. And we can rest assured that Dr. Felsenfeld will have a wonderful tutor in this position.
Well, I'm happy to mentor him, certainly. And thank you for putting up with me and my use of technology during these WebEx meetings.
Congratulations to all of the board members, which will essentially take effect on January 1st of 2021. Board President, that concludes the election.
Thank you, Ms. Fisher. We will now move on to agenda item 18, board member comments on items not on the agenda. Are there any board member comments on items not on the agenda?
Yes, hi, this is James Yu. I just want to give thanks to our President Stewart. He has been doing an excellent job for all these years for the board. Thank you so much.
Kind remarks. Thank you, James. Okay, I see no further comments. So I think this meeting is over. I'm going to adjourn it. And again, I want to welcome our newer members and thank you for your participation. We look forward to working with you in the future. That concludes our December 4, 2020 quarterly dental board meeting. Goodbye and good night.
Happy